Prostate cancer is the most commonly diagnosed cancer in men, second only to skin cancer. That's according to the American Cancer Society. And now research could lead the way for better treatment. ABC 7's Alex Redmond has more. Alex.
Thanks, Haley. A diagnosis of prostate cancer is devastating, but weighing your options of treatment can be overwhelming. There's radiation, surgery, even a wait-and-see approach. Well, now a large-scale study reveals which is the most common treatment by far. He received his diploma and graduated with flying colors.
I started in January and do me 30 sections, DART.
Roberto Stiglitz traveled far to Deitoli Cancer Center for radiation treatments.
I came from Peru.
Physician Doug Hendren also opted for radiation after studying all options for his condition.
Which was my age, the PSA number, the grade of cancer.
An MRI, says Hendren, confirmed what the numbers would have predicted.
That in my case, the cancer was probably not contained.
That made surgery a lot less predictable.
If you have the cancer that's a little bit outside the capsule, it's harder to remove it surgically without spilling something and leaving something behind, and then I would need radiation anyway.
A 3-year study of more than 37,000 patients finds radiation therapy is the most common treatment for prostate cancer at 58%, regardless of the aggressiveness of the tumor, risk to the patient, and overall prognosis.
Radiation, number one, has a very long track record. Number two, has a very high cure rate. And number three is somewhat innocuous. You're not having scalpels and, knives and wounds to heal and wearing catheters.
Surgical procedure to remove the prostate followed at 19%, with other treatments trailing in at 10%, including watchful waiting and active surveillance.
But it also entails doing biopsies once or twice a year, doing quarterly PSAs.
Frequent MRIs and ultrasounds yielding 3D images.
It's a rigorous program. It's not doing nothing.
The unknown, says Dr. Deitoli, is why choosing the best treatment is so important.
If prostate cancer is going to behave like a tiger or a pussycat, we don't know.
Prostate cancer can be a serious disease, but most men diagnosed with prostate cancer don't die from it. In fact, more than 2.9 million men in the U.S. who've been diagnosed with prostate cancer at some point, they're still alive today.
And Alex, why would some of these patients opt for that wait-and-see approach?
It would greatly depend on their age and if you're old and you're frail. And also it depends on the type of cancer that you have. So for some people, they might actually live out their natural life before the cancer actually gets them. So for some people, the wait-and-see alternative is an alternative.
All right. Thank you, Alex.